quite a few injuries to high school student athletes so far this year, so I spoke to our medical expert, Dr. Kevin Campbell, about how to best avoid them. Turning to health news now, if you have kids on the high school playing fields this fall, you know that it can be very dangerous, especially if they're playing football. We're talking about sports-related concussions, and they are on the rise. And here to tell us more about head injuries and how to really avoid them is our medical expert, Dr. Kevin Campbell. We hear a lot about it, but what is a concussion?
So as you might imagine, your head is encased in a bony skull,
right,
and your brain's kind of this squishy organ that is also encased in fluid called cerebrospinal fluid.
Right.
When you get hit in the head, your brain hits one hard side of the skull and then bounces back to the other side. And that jarring of the brain can disrupt neurologic pathways and can actually cause permanent damage and even death in certain situations.
So, you know, we hear about concussions. What are some of the common head injuries that, you know, a high school football player, really at any level, will suffer?
You know, especially in football, over 50% of all concussions in high school occur in football, but also kids playing soccer, kids playing basketball, and things like that. Lacrosse can also get concussions. The thing to remember is the signs and symptoms that you should think about can go anywhere from nausea and vomiting, foggy headedness, irritability, to unconsciousness. It's important to remember that you don't have to pass out to say you have a concussion. 90% of concussions have no loss of consciousness.
Yeah, so how do you recognize it? Is it just sort of a precautionary measure? If you even suspect it, shouldn't you take that player out of the game?
I think that's absolutely right. If you see a child take a hit to the head and they get up and they're a little foggy, a little dazed, they need to come out of the game and they need to be evaluated. I know that the North Carolina Trainers Association here in North Carolina for high school trainers is really making a push to make sure that all of the coaches and parents and school administrators understand what to do. And these children should not be allowed back in the game until they have passed neurologic testing and exams, because this can be a medical emergency.
So is there anything that we can do to prevent this?
First of all, use good protective equipment. Understand how to tackle property and things of that sort.
So great information there, Doc.
Good to see you,
As
sir.
always great to have him in, Dr. Kevin Campbell. And if you want to get a hold of Dr. Kevin Campbell, we've got all of his information on our website. Just go to WNCN.com. Always great to have you in.
Thanks so much for